How to get your stomach back after pregnancy. Congratulations! Your body has just given birth to a new human being. That is really fantastic. If you're like most of us, you've undoubtedly acquired a few battle wounds to show for it. Yes, we're talking about post-pregnancy fun like fatigue, emotional roller coasters, and tears, as well as that post-pregnancy tummy. On certain days, you may even feel compelled to choose between a flat stomach and baby hugs. But, for now, appreciate your body for what it has accomplished and understand that an instant flat belly is overrated. And probably better suited to superstars with personal trainers and live-in nannies. Following that, you may take hope in knowing that there are things you can do to shed the baby weight that appears to stubbornly cling to your waist. But what happened to your belly? Now that the baby has been delivered, what is causing the belly to enlarge? Is it belly fat, loose skin, hormones, or something else? It's a little bit of everything. You gained some weight, which is precisely what you should have done. Your abdominal muscles, which are two parallel bands of muscles that support your core, were stretched out. Consider this: the typical newborn weighs around 7 pounds, 3.2 kilograms. To create room for it, your abdominal muscles, abs, and connective tissue have to expand apart. Simultaneously, your small intestine, sigmoid colon, and stomach graciously moved over to make more place for the baby. In addition to the weight gain and stretching, your body generated hormones to increase the elasticity of the connective tissue. Take in that newborn smell. You worked hard for it. Losing the post-pregnancy belly. Depending on your BMI, you should gain 11 to 40 pounds, 5 to 18 kilograms, during a single baby pregnancy. And 25 to 62 pounds, 11 to 28 kilograms, while pregnant with twins. The good news is that you'll shed some of that weight immediately after giving birth. The baby's weight is the first to go. This is self-evident. You'll also lose a few pounds straight soon as a result of the loss of blood, fluids, and amniotic fluid. During the first week following delivery, you may notice that you are going to the toilet more frequently and that your pajamas are drenched with perspiration when you wake up in the middle of the night. This is because perspiration tends to rise when your pregnancy hormone levels decline. Without any work, you might lose up to 20 pounds, 9 kilograms, by the end of the first month. Wait another 2 weeks for your uterus to return to its usual size, and your belly will seem flatter. And if you're breastfeeding, you should know that it's not only about feeding and cuddling, it may also help you lose weight. Breastfeeding mothers need 400 to 500 calories per day to produce the full quantity of milk that most infants require from birth to 6 months. Furthermore, mothers who exclusively breastfeed for more than 3 months lose more weight than those who do not. However, not all nursing mothers lose weight rapidly. Most doctors and physical therapists recommend waiting 6 weeks after an uncomplicated vaginal delivery, or 8 weeks after a cesarean delivery before beginning a structured exercise regimen. So, it's been almost 8 weeks after your birthing, and you're feeling stronger and more like yourself. Here's how to be proactive and safely get your flat belly back. Proactive steps to safely get rid of your belly. 1. Exercise right. Exercise and a healthy diet will help you return to your pre-pregnancy weight within a few months. However, if you want to see your belly flatten, you'll need to undertake some abdominal muscle targeting workouts. And here's the trick: don't start with crunches right away. Remember the connective tissue that extended out between your abdominal muscles. All pregnancies have some stretching, which is typical. The tissue will rebuild itself as it heals. However, preliminary research indicates that belly crunches performed too soon strain the connective tissue, even more, making it thinner and weaker. This is not what you want in a robust, supporting core. To begin, you should work on strengthening your deepest abdominal muscle, the transverse abdominis. Consider this muscle to be your body's internal girdle. While you should see a physical therapist or your doctor about other exercises that you can do safely, pelvic tilts are an excellent place to start. Tie a sheet across your belly to support your abs and perform the following. Lie on your back, place your feet flat on the floor, and bend your legs. Pull your belly button in toward your spine and lift your pelvis off the floor. Tighten your buttocks and hold for 5 seconds. Aim for 5 sets of 20 repetitions. You should be able to go to deeper abdominal workouts in 8 to 12 weeks. Are you wondering how frequently is enough? According to the American Council on Exercise, muscle toning abdominal workouts can be performed 2 to 3 times per week. Here are some effective belly tightening exercises you should try. Forearm plank. Lie down with your forearms on the floor. Rise up onto your toes. Suck in your belly. Tighten your buttocks. Hold for 20 and build up as you get stronger. Reverse crunch. Lie down on your back with your knees bent and your thighs perpendicular to the ground. Using your abs, bring knees toward your chest. Hold for 2 counts and repeat 10 times. Scissor kicks. Lie on your back with your legs straight. Lift both legs off the floor and then scissor your legs by lowering and lifting them alternately. Do 15 to 20 repetitions. Diastasis recti occur when your abs have separated by more than 2 to 2.5 centimeters. Most diastasis recti instances improve with time, weight reduction, yoga, and core exercises. Because diastasis recti is not a real hernia, surgical correction is not always necessary. 2. Eat well. When you're caring for a baby around the clock, it's easy to go for the chocolate and abandon healthy eating habits. Especially in the middle of the night when the rest of the family is deep asleep. So here are some easy, tasty, healthy snacks. High-fiber cereal to keep your system running smoothly. Cut up vegetables and fruit. Yogurt without added sugar sprinkled with granola or dried fruit. Now the next question is, what's right, belly wraps, girdles, or corsets? All of these products will support your stomach and lower back and give you a flatter stomach, but they will not modify your form. Moms who have had a cesarean delivery will frequently recommend them since they can help the wound heal by relieving pressure. But C-section mothers aren't the only ones who like it. Here's the nitty-gritty. Belly wraps are made of adjustable elastic that covers your torso from ribs to hips. Waist cinchers are usually made of a stiffer material, cover you from below the bust to the hips, and have a hook and eye closure. They give you extra compression that can cause more harm than good, so you'll want to avoid these. Corsets aren't just a relic from the 1850s. You can still find them today, but they'll give you the extra compression you want to avoid. If your doctor advises you to use a belly wrap, you'll most likely wear it for 10 to 12 hours every day for 6 to 8 weeks. Sounds appealing? Remember that you must still train those abs before you can completely wave goodbye to that belly. Please check the description section of this video for some belly wraps to consider. What you should take away from this video. You're eating well, exercising, working on your abs, and your stomach is still there. What should I do now? Don't be concerned if you still have a tummy 3 or 6 months after giving birth. The adage 9 months to put it on, 9 months to take it off may not be scientifically valid. But it is based on the experiences of countless parents just like you. If you believe the baby weight has become a permanent part of you, or if you have any other questions, get advice from your health practitioner. And take another breath of that wonderful newborn fragrance while resisting the urge to compare notes with other parents, because we're all on our own road.